WHO report on tobacco control. Why in news? The World Health Organization, WHO, recently released a comprehensive report on tobacco control measures. The report evaluates the progress made globally since the introduction of the Empower measures, a set of strategies developed by WHO to combat tobacco use and its detrimental effects on health. What are Empower measures? In 2008, the WHO established Empower, a plan consisting of the 6 most important and effective tobacco control methods. The 6 Empower strategies include: M. Monitor tobacco use and prevention policies. P. Protect people from tobacco smoke. O. Offer help to quit smoking. W. Warn about the dangers of tobacco. E. Enforce bans on tobacco advertising, promotion and sponsorship. R. Raise taxes on tobacco. What are the major highlights of the report? Global tobacco control progress. Worldwide, there has been a decline in smoking prevalence from 22.8% in 2007 to 17% in 2021, resulting in 300 million fewer smokers today. The WHO's Empower measures have played a vital role in tobacco control over the past 15 years, protecting 5.6 billion people, 71% of the global population, with at least one measure. The number of countries implementing at least one Empower measure has risen from 44 in 2008 to 151 in 2022, and 4 countries, Brazil, Turkey, Netherlands, and Mauritius, have successfully implemented all measures. Addressing the challenges. The report also sheds light on the challenges that need to be addressed for more effective tobacco control. At least 44 countries still do not implement any Empower measure, and 53 countries do not have a complete ban on smoking in healthcare facilities. Additionally, only half of the countries enforce smoke-free workplaces and restaurants. WHO emphasizes the dangers of e-cigarettes, noting that the tobacco industry's aggressive promotion of e-cigarettes as a safer alternative undermines progress. E-cigarettes pose risks to both users and those around them, especially in indoor environments. Second-hand smoking. Of the estimated 8.7 million tobacco-related deaths annually, 1.3 million are non-smokers exposed to second-hand smoke. Second-hand smoke is linked to almost 400,000 deaths due to heart disease. Moreover, second-hand smoke adversely affects children, leading to severe asthma, respiratory tract infections, and sudden infant death syndrome. Around 51,000 deaths in children and adolescents under 20 years are attributed to exposure to second-hand smoke. India's progress in tobacco control. India excels in implementing health warning labels on tobacco products and providing tobacco dependence treatment. About 85% of cigarette packs in India carry health warnings on both the front and back, placing the country among the top 10 in terms of warning label size. India has also banned the sale of e-cigarettes and implemented smoking bans in healthcare facilities and educational institutions. Bengaluru has seen significant progress in tobacco control due to hundreds of enforcement drives, no smoking sign displays, and extensive awareness campaigns about the hazards of smoking and second-hand smoke. The city's efforts have led to a commendable 27% reduction in smoking in public places. What is the status of tobacco consumption in India? About nearly 267 million adults, 15 years and above, in India, 29% of all adults are users of tobacco, According to the Global Adult Tobacco Survey India, 2016 to 2017. The most prevalent form of tobacco use in India is smokeless tobacco. It is one of the major causes of death and disease in India and accounts for nearly 1.35 million deaths every year. India is also the second largest consumer and producer of tobacco. Related government initiatives. National Tobacco Control Program. Promulgation of the Prohibition of Electronic Cigarettes Ordinance, 2019. Cigarettes and other tobacco products. Prohibition of advertisement and regulation of trade and commerce, production, supply and distribution. Amendment Rules, 2023. National Tobacco Quitline Services, NTQLS. The Union Finance Minister of India announced a 16% increase in National Calamity Contingent Duty, NCCD, on cigarettes in the budget 2023 to 1924. The Union Health Ministry of India has announced new regulations requiring over-the-top (OTT) platforms to display tobacco-related health warnings during streamed content. State of formal employment in India. Source: ET. Why in news? Employees' Provident Funds, EPF, data indicates net increases in contributors, but this contradicts ground reports of unemployment and job scarcity in India. The Indian government has been using the EPF's data to measure the formal employment creation since 2017. What is formal employment? About. Formal employment refers to a type of employment where the terms and conditions of work are regulated and protected by labor laws and employment contracts. It is characterized by certain features that distinguish it from informal or casual employment. Key features. Written contracts. Formal employment typically involves a written employment contract that outlines the terms of employment, including job responsibilities, working hours, compensation, benefits, and other terms and conditions. Social security. Formal employees are often entitled to social security benefits such as health insurance, retirement funds, provident fund, unemployment benefits, and other forms of financial protection. Labor rights. Formal employees have specific labor rights protected by law, such as the right to join trade unions, collective bargaining, protection against unfair dismissal, and access to legal recourse in case of disputes. Regular payment. Formal employees receive regular wages or salaries, usually on a fixed schedule, which provides a stable income source. Informal employment. Informal employment refers to work that is not regulated or protected by labor laws, lacks formal employment arrangements, and often operates outside the scope of government oversight. Informal employment can lead to precarious working conditions and hinder economic growth as it may result in lower productivity and higher income inequality. What does the EPF data say about formal jobs? EPFO's annual reports show a stagnant or declining number of regular contributors, those with consistent PF contributions, in recent years. Between 2012 and 2022, the number of regular contributors to the EPF increased from 30.9 million to 46.3 million. Between 2017 and 2022, the number of regular contributors increased only from 45.11 million to 46.33 million, showing a slowdown in growth during this period. Total EPF enrollments increased significantly, but the corresponding increase in regular contributors was minimal. Between 2017 to 2022, overall EPF enrollments increased from 210.8 million to 277.4 million. The difference between the total number of EPF enrollments, 277.4 million, and the number of regular contributors, 46.33 million, indicates that a significant portion of enrollments is not resulting in regular contributions. The majority of EPF enrollments are linked to temporary or casual jobs with irregular PF contributions. Factors leading to the decline in contributors. The EPFO disputed its own data and stopped publishing monthly reports on regular contributors. The pandemic further worsened the situation, leading to a decline in EPF contributors. The Indian government neglected other sources of formal employment data, like the Directorate General of Employment and Training, DGET, which has not been published since 2013. What is the scenario of the job crisis in India? Unemployment rate. According to the National Statistical Office's NSO Periodic Labour Force Survey (PLFS) report for the year 2021 to 2022, the unemployment rate for 2021 to 2022 was 4.1%. Low labour force participation rates (LFPR). According to Centre for Monitoring Indian Economy (CMI), India's LFPR fell to 39.5% in the financial year 2022 to 1923. This is the lowest LFPR reading since 2016 to 2017. The LFPR for men stood at a 7-year low of 66%, while that of women was pegged at a mere 8.8%. The LFPR is the share of the working-age population, aged 15 years and above, that is employed or unemployed, willing and looking for employment. What are the causes of low employment in India? Absence of formal and quality job. The absence of formal, well-paid, and regular employment inhibits the expansion of India's middle class, unlike China's growth model. Lack of quality jobs leads to overqualified youth competing for limited job openings, raising concerns about claims of strong economic growth. Social factors. In India, the caste system is prevalent. The work is prohibited for specific castes in some areas. In big joint families having big business, many such persons will be available who do not do any work and depend on the joint income of the family. Dominance of agriculture. In India, nearly half of the workforce is dependent on agriculture. However, agriculture is underdeveloped in India. Also, it provides seasonal employment. For small industries. The industrial development had adverse effects on cottage and small industries. The production of cottage industries began to fall and many artisans became unemployed. Limitations in education system. Jobs in the capitalist world have become highly specialized, but India's education system does not provide the right training and specialization needed for these jobs. Thus, many people who are willing to work become unemployed due to lack of skills. How are the rights of labor protected in India? Constitutional framework. Under the Constitution of India, labor as a subject is in the concurrent list and, therefore, both the central and the state governments are competent to enact legislation subject to certain matters being reserved for the centre. Judicial interpretation. In the case of Randhir Singh versus Union of India, The Supreme Court stated that even though the principle of equal pay for equal work is not defined in the Constitution of India, it is a goal which is to be achieved through Article 14, 16 and 39 C of the Constitution of India. Legislative framework. There have been several legislative and administrative initiatives taken by the government to improve working conditions and simplify labor laws. Most recent is the consolidated sets of 4 labor codes. Code of Wages, 2019. Industrial Relations Code, 2020. Social Security Code, 2020. Occupational Safety, Health and Working Conditions Code, 2020. What are government's initiatives to curb unemployment? Support for marginalized individuals for livelihood and enterprise, SMILE. PM Daksh, Pradhan Mantri Dakshta और कुशलता संपन्न हितग्राही. Mahatma Gandhi National Rural Employment Guarantee Act, MGNREGA. Pradhan Mantri Kaushal Vikas Yojana, PMKVY. Startup India Scheme. Rozgar Mela. Way forward. Relying on a single data source, like the EPF, overlooks the complexity of India's labor market. Comprehensive labor statistics, like the PLFs, provide a more accurate picture and call for urgent policy interventions to address the jobs crisis in the country. The formal job crisis in India requires a multifaceted approach to address the underlying issues and create a conducive environment for formal employment generation. There is a need to encourage industries that have a higher labor intensity, such as manufacturing and certain services, to create more formal job opportunities and reduce reliance on informal sectors. There is a need to investing in skill development programs that align with industry demands can enhance the employability of the workforce and lead to better quality formal jobs. UPSC Civil Services Examination, Previous Year Question, PYQ. Enhancing social security for unorganized workers. Why in news? Recently, the Union Minister of State for Labour and Employment shed light on the significant strides made in the realm of social security for unorganized workers during a written reply in the Lok Sabha. Aligned with the Unorganized Workers Social Security Act, 2008, the government has formulated a range of welfare programs, spanning life and disability coverage, health benefits, maternity support, and old age protection. Unorganized workers constitute about 93% of the total workforce or around 43.7 crore workers in India. Social Security Code, 2020 aims to regulate the organized, unorganized, or any other sectors and extend social security benefits during sickness, maternity, disability, etc. to all employees and workers across different organizations. What are the various initiatives related to social security for unorganized workers? Life and disability cover. Pradhan Mantri Jeevan Jyoti Bima Yojana, PMJJBY offers a life cover of 2 lakh rupees for insured individuals, regardless of the cause of death, at an annual premium of Rs 436-. Pradhan Mantri Suraksha Bima Yojana, PMSBY, available to the people in the age group of 18 to 70 years with a bank post office account. Provides accidental death or disability cover of 2 lakh rupees and 1 lakh rupees respectively, at a nominal premium of Rs 20 per annum. Over 16.92 crore beneficiaries enrolled under PMJJBY and 36.17 crore beneficiaries under PMSBY nationwide. Health and maternity benefits. Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. A PMJ ensures health insurance coverage of up to 5 lakhs rupees per family for secondary and tertiary care hospitalization. As of July 2023, verified approx 24.19 crore beneficiaries and created Ayushman cards across the country. Old age protection. Pradhan Mantri Shram Yogi Mandhan, PMSM launched in 2019, provides a monthly minimum assured pension of Rs 3,000 for workers aged 60 or above with a monthly income of Rs 15,000 or less. Beneficiary contributes 50% monthly, matched by equal contribution from the central government. Enrolled around 49.47 lakh beneficiaries nationwide. eShram portal. Launched by the Ministry of Labour and Employment in 2021. Aims to create a comprehensive database of unorganized workers. Approx. 28.97 crore workers registered on eShram portal, including details like name, occupation, address, education, skills, and family information. Additional schemes for unorganized workers. One Nation One Ration Card, public distribution system under the National Food Security Act. Mahatma Gandhi National Rural Employment Guarantee Act, MGNREGA provides employment opportunities. Deen Dayal Upadhyay Gramin Kaushal Yojana, skill development programs. Pradhan Mantri Awas Yojana, affordable housing scheme. Pradhan Mantri Garib Kalyan Rojgar Yojana, employment generation during the pandemic. Mahatma Gandhi Bunkar Bima Yojana provides enhanced insurance cover to the handloom weavers in the case of natural as well as accidental death and in cases of total or partial disability. Deen Dayal Antyodaya Yojana, promotion of multiple livelihoods and improved access to financial services for rural poor households across the country. Pradhan Mantri Kaushal Vikas Yojana, vocational training and certification of Indian youth for a better livelihood and respect in society. Unorganized Workers Social Security Act, 2008. The Act defines unorganized workers as those who work in the informal sector or households, without any regular employment or social security benefits. The Act empowers the central government and the state governments to frame schemes for providing various social security benefits to unorganized workers, such as life and disability cover, health and maternity benefits, old age protection, education, housing, etc. The Act also provides for the constitution of a National Social Security Board and State Social Security Boards for unorganized workers, which will advise and monitor the implementation of the schemes. The Act mandates the registration of unorganized workers by the district administration and the issuance of identity cards to them. The Act also envisages the establishment of workers' facilitation centers to provide information and facilitate access to the schemes. Code on Social Security, 2020. The Code on Social Security, 2020 aims to extend Social Security to all employees and workers either in the organized or unorganized or any other sectors and for matters connected therewith or incidental thereto. The code can be applied to establishments subject to size threshold through notification by the central government. Separate social security funds will be set up by the central and state governments for unorganized workers, gig workers, and platform workers. Registration provisions are specified for unorganized workers, gig workers, and platform workers. A National Social Security Board will be established to recommend and monitor schemes for these categories of workers. Funding for schemes of gig workers and platform workers may come from contributions by central and state governments, as well as aggregators. Penalties for certain offences have been reduced, including obstructing inspectors and unlawfully deducting contributions from wages. During an epidemic, the central government may defer or reduce employer and employee contributions under Employee State Insurance (ESI) and Provident Fund (PF) for up to 3 months.